I'm Tony Esselin.
And I'm Amy Bernard.
And we are here to help make it make sense.
This is the podcast that takes complicated science and breaks it down into easy to understand language.
So buckle up, buttercups. You are in for a bumpy ride. Hey, we're back. Season 3. Season 3. Can we share with the people that we were harassed for more podcasts? Isn't that cool?
I know. We were asked by multiple people.
That's right. They were, when is the next episode? When is it dropping? It's been too long.
Exactly. And we need to tell you, it was not just our moms.
It was not just our moms. That's right. We'll confess one of them was my husband, but that's okay.
The other yes, it was multiple people.
Yes. Say that again. You cut out. What did you say?
I said none of them were family members for me.
Wow.
So yeah. Also, we have been in the press.
We have.
We were in Futurum Careers. We had our podcast highlighted. Mm-hmm. And then also we're in the Rochester Review.
That was very cool. Nice spread in our little alma mater there.
Yeah, our alma mater. And we were were there 7 or 8 experts that were talking about the pandemic and how to the title was Better Next Time. I prefer no next time, but I do prefer being prepared. So
That's right.
Yeah.
Kudos to us.
Yeah.
Yeah. And so those of you who are listening, you're listening to the real deals. The real deals, okay? That's very exciting. Very exciting.
Yeah. So we took a little summer break, but now we're back. We're going to do kind of a short one, but we just wanted to talk about some of the updates in the world of SARS-CoV-2 and COVID.
Yeah, exactly. We're in the fall season is coming upon us, respiratory season, as we like to call it. Mm-hmm. And there's a lot going on. So I think we wanted to give you guys kind of our thoughts about the fall season and COVID and, maybe just some brief updates on other things and and answer your questions. Please remember to send us some questions, and we're going to try to mix up this season by talking about other viruses. HPV will be on the list. We're going to talk about that and other things that come down the pike or any other interests that come to mind. I think so I wanted to start this conversation today with talking a little bit more about masking. And then we're going to just kick it off to our vaccines and the new vaccines that are coming up so you know what to do. But masking, such a controversial issue, right? Such a controversial issue. People are like, I don't want to do it, blah, blah, blah. Much more people are masking less these days. And maybe some, now that there's an uptick again of COVID, maybe some folks are pulling out their masks a little bit more. We're going into the holiday season and everything like that. So things are going to, we're going to be indoors a lot more. So there's going to be a lot more risk. And this, if we have any indication from the last 3 years of this thing, this is the time when things start to just go up from a respiratory perspective, right? And so I just wanted to talk about masking because a lot of people just don't know what to do about it. And I think that what I've decided for myself is that, for all of the things, and we're going to talk about the vaccine and we're going to talk about the vaccine updates and we're going to talk about all the other tools, but at the end of the day, you have to ask yourself the question, how interested are you in keeping yourself from getting sick? This is a different time now, right? We're 3 years into this pandemic. We are going to hit 4 pretty soon, unfortunately, and it's still around. So I think that what you have to ask yourself, so 3 years ago when we started this, or 2 years, we started this about 1.5 years ago, this podcast. And I think at that time we were very worried, very concerned about, mortality, very concerned about serious disease and serious illness and serious conditions. And so we were like, oh my God, hurry up, get vaccinated, mask up everywhere and all of this stuff. Now we're at a place where you have either been vaccinated a couple of times, a few times, or you have gotten infected a few times. And so those are like the two. I don't think that there are a lot of people who have not been vaccinated and not infected at this point. I'm not going to say zero, because I don't think zero exists ever. I don't think so. But for the most part, the two categories of humans are humans that have been fully vaccinated or updated with their vaccines, keeping track of all of their vaccines. And then you have the other humans who may have gotten one or two vaccines and gotten infected, or folks that have not gotten vaccinated and been infected, maybe one or two or three times, honestly, at this point. And so the question now to ask yourself is like, what is your risk tolerance for being ill? That's it. And, you know, it's not that the danger of COVID has gone away necessarily. There are still folks that are dying of COVID. That's still true. A lot of those folks, you know, or hopefully are, you know, folks that are getting seriously ill, or at least having more tools at their disposal in terms of medication management, you know, the skill levels of physicians who are taking care of them, and nurses, and allied health professionals. All of those skill sets are better than it was when we were scrambling 3 years ago and not knowing what we were dealing with. So there's a lot more protocols in place, and those things are still smooth, and people are still dying of COVID, right? Not in as many numbers as they were before, but that's still happening. And so the thing is that you have to ask yourself, you know, if you've got things planned, like I'll just, you know, I like to keep it to myself and my perspective. I have a lot of things planned between now and January. You know, I got a lot going on. We got family events coming. We're going on vacation for Christmas and stuff. We're going to go away, which is really cool for the first time, and New Year's. And so I don't want to get sick. Not that I won't be able, because travel restrictions are decreasing, right? Like all of those things are different, but I want to enjoy myself. I don't want to be sick. I don't want to be miserable. I don't want it. I had it last year and it was horrible. And it just reminded me how much sicker I would have been if I hadn't gotten vaccinated. It scared me because I was pretty sick. I wasn't hospitalized, but I was laid out. And so for me, putting on a mask, going on an indoor, like outdoors, I'm out there. I don't have my mask on. When I'm walking down the street, I don't have my mask on. If I'm in a crowded street, like if I'm like, whoa, this is like a little crowded, I might just sneak it on, because people just like to breathe on you. And I don't want people breathing on me. But for the most part, when I'm outside, I don't have a mask on, right? If I'm walking around, if I'm eating outside, I don't have a mask on. And to be honest, I wouldn't be, you know, if I'm eating inside with a friend. I saw a really good article in the New York Times that was just like, hey, if I get COVID because I'm having dinner with a friend that I haven't seen in a long time, you know, okay, that doesn't feel crappy. But like getting COVID on the subway, that feels crappy to me, right? And so it's kind of like trying to I love that article, because I was just like, oh, trying to balance, you know, if I don't put my mask on in this particular situation and I get COVID, am I going to be annoyed, or am I going to be like, well, okay, that came with the territory, right? And so maybe getting COVID because you're hanging out with a good friend that you haven't seen in a long time, you know, it still sucks. It doesn't mean that it doesn't suck, but it's not as annoying as like you were riding the bus, you know, going to work, and then you got it because you were riding the bus going. That's not fun, right? Like that's not fun. And so I think when it comes to masking, it's just trying to understand what your risk tolerance is. It's a still very effective mechanism and method to decrease your risk of getting infected. You know, you have to get, you know, you guys are still walking around with those flimsy surgical masks. That's not going to do it. You need the K95 or the N95 masks, and that's well fitting. So that's going to be the thing to do. I wasn't wearing it in the supermarket for the summer, I think, because there were, you know, it was more summertime. If I was just going to go in and out, you know, I didn't put it on if I knew what I was getting and I was going in and out. But like now, because the numbers are going up, I'm not in the mood. I'm masking it up just to go to the grocery store. If I feel like people are in too close proximity, I'm putting the mask on. I'll take it out of my purse. I'll put it on my face. You know, I always carry it around with me, and do my best to try to stay protected. I've always wear it on the plane, because I want to get someplace and not be sick. That's just me, you know, that's just me. And I think that, like, that's what you have to do, is just ask yourself, you know, I've got things coming up. I don't want to be sick. Do I want to be sick? Maybe you think like you'll be sick for 2 days and you'll be able to shake it off like a regular cold. But everybody's different. Like, you don't know how it's going to affect you. Right. So again, I recommend it in this respiratory season. And there's a lot of stuff we were just talking right before we started recording. You know, these even regular colds and regular viruses are hitting us harder, right? They're just hitting us harder. They're lasting longer. It's miserable. It's not only COVID I'm hiding from everything. I don't want anything. I don't want anything in my lungs at all. People like breathing on you, man. It's like, I was in this panel thing yesterday, and somebody was just like, hi. Like right on my face. And I was like, oh God, hi. So anyhow, so risk tolerance, assess it for yourself. You know, don't just sit there and be like, I would rather you go through the thought process of being like, you know what, what's the COVID risk here? There's a lot of people out there. You know, if I get COVID, I'm going to be annoyed, but it's going to be like, it's not going to be that annoying. Like I'm going to be able to deal with the consequences of whatever it is. I would rather you kind of go through that thought process as opposed to just being careless about it and just being like, oh, you know, I don't want your answer to be nobody's wearing masks anyway. That shouldn't be the thought process. It should be for you. Who cares about everybody else? Never mind. That's none of your business. What is your risk tolerance for getting sick in that particular like endeavor? And so for me, for the next few months, indoor events, as much as I can, I will be putting my mask on. Indoor, you know, people on top, I'm going to be putting my mask on for the most part, if I can. And so I think, you know, you should consider it as well. It's a tool. It helps. It doesn't cost anything. If you just, you know, if you have your masks with you, there are some places that are still giving out PPE. So definitely look out for those places if you want to stock up on those things. And, you know, try to stay away from people as much as you can in terms of like personal space, so that you decrease your risks of getting whatever it is that someone else could be harboring that you don't know. And that's my spiel. Amy?
Awesome. I agree. I still have not had COVID, so I know I've been near it. There's no way that I haven't been. I agree with you. I think your own risk tolerance. I mask. We've flown. We had to move our daughter across country for college, and I was wearing my mask on the plane both ways. Sadly, when I came home, I had a horrible sore throat, stuffy nose, cough, lasted, I'm going to say, honestly, it was 3 weeks, but I got tested for COVID and strep. It was neither of those. So I concur with you, Dr. Tony, that probably the first real illness since the pandemic started, and it was having a little bit too much fun with me. It was taking me for a ride. So I think, yeah, it's been interesting, but yeah, it was not COVID, thankfully. Again, not strep throat. I didn't really know that it would be, but I thought, because my throat hurts so much, like I'll just, you know, see, and it wasn't. So obviously some other illness, some other virus that's, you know, still out there. Here's what I think happened. I think I must have walked into a freshly coughed pocket of air.
Oh no, not the freshly coughed. Oh, disgusting.
I mean, because on those flights and things, I was wearing my mask, you know, if somebody coughs and I'm in a pretty busy location, like my mask will come on. So had to have been coughed. They walked away. I didn't hear them.
You see the molecules in the you're like,
if I could see them, I don't know that I would walk anywhere. I think that's what keeps us from, just hiding in our houses all day, is the fact we can't see them. But anyways, so yeah, I agree with Dr. Tony that, your risk tolerance, I have, I think, similar philosophy of putting my mask on when I'm in really crowded areas. I keep one in my backpack, and I'm a nerd. I carry a backpack. I don't really carry a purse. I got my computer with me and my mask. But yeah, so I think that's really important. And I think we just need to keep thinking about how when the pandemic started, we didn't really have any tools, really. Now, and I guess masks existed, but people, it was not recommended at first to start wearing them until we had some more data that was respiratory, which made sense. But I think that we have the mask as a tool. And again, like the good ones, you don't want just, a piece of cloth or whatever, like the N95 or KN95 provide the most protection. Another tool we have, we'll talk about vaccines here in a minute, but also the antivirals, that if you are infected and it's recommended by your physician, certain age or comorbidities or other things to take Paxlovid, that's, I think, still can decrease the illness and severity. So that's another tool that we have.
Can I just add to that real quickly? Yeah. Don't wait for your physician to offer it, because they're not offering it enough. I think that like there's still some more education that we need to do for providers, but it's not as automatic as it should be. And I think that I want to encourage people who are listening, like if you get COVID and you're sick, ask your doctor about Paxlovid, because it's not going to be a natural response. Unfortunately, we're not there yet for some reason. And those are things that we're working on. At the community that I work in, we're trying to like improve that, but there's still, I would say that don't wait for it, advocate for it, because it's something that you can still access. Like you said, it is a tool, but it's an underutilized tool. It's an underutilized tool. And I think that we need to do better with that.
Okay. Well, that's good to know, because since I have not had COVID, I have not had the opportunity.
Stop showing off, Amy.
To be offered.
Stop showing off.
I will tell you what, probably the next time, and this is our segue into vaccines. Maybe the next time I see you, I will show off my Band-Aid.
Oh God. Oh, God. Not the Band-Aid.
I know.
Oh,
you're
and I want to just say before you go into vaccines, you reminded me that the other advocacy I wanted to make was more about, and this is more for the community protection, is that like nobody's wearing masks in healthcare facilities anymore. And I know that it's not a mandate, it's not a federal mandate anymore, and the private hospitals have the right to do whatever it is that they want. But like, I think it's a little irresponsible to go into a healthcare facility and not have your mask on. Because you just don't know who's around you. And people are obviously in the healthcare facility. Some people are doing prevention, but in America, we're doing acute medicine, right? Like everything that our prevention chops are not very good. And so I think that, my advocacy to our listeners is that at least when you're going into a healthcare facility, mask up, because if it's not for you, it's mostly for everybody else, right? Like if you're like, oh, I don't care about me, or I'm not worried about me, not necessarily care, but you're not worried about yourself, worry about other people who might be vulnerable, and so who are in the healthcare facility. And so mask up in that, that's like a strong recommendation. I wish people did that more. And even me, when I go to the doctor, I'm like some of my healthcare colleagues are not wearing masks in the clinics anymore. And everybody has their reasons, but I think that for you should protect yourself as much as possible. And in healthcare facilities, we're seeing, as providers, we're seeing tons of people a day who are sick. And you never know. We're looking in mouths, we're looking up noses, we're looking down throats, And so, yeah, that's my other plug. Now go ahead and talk about vaccines. I'm going to shut up.
Yeah, I agree with that too. The other thing, if you go somewhere and you're going to, want to get tested for COVID or strep throat or whatever it is, you don't know what those other people are in there being tested for. You don't know why they're there. So let's just assume that they're there for something that could be in a freshly coughed pocket of air.
That you don't want. You don't want to inhale that. It's gross.
Exactly. You don't want to inhale that. So yeah. Okay. So the last tool that we're going to be talking about our vaccine. So we have a new vaccine that is coming out this fall that should be arriving into our pharmacies and clinics, hopefully in the next week or so. Yes. So what I'm going to be telling you about the new vaccine comes from information that I got from epidemiologist named Caitlin Jetelina. She has won Science Communication Awards. She has a blog on Substack called Your Local Epidemiologist, or YLE. You can get it for free. I am a paid subscription member because I don't want her information to run out. So we will put her information into the show notes if you want to look her up. Subscribe. I think you can subscribe for free, but I would recommend looking her up. So a lot of the info that I have pulled today comes from her YLE, Your Local Epidemiologist. So she sat in on the ACIP committee, which is the Advisory Committee on Immunization Practices for the Centers for Disease Control, or CDC. And this was on September 12th, I believe. And basically, the bottom line is that everyone over 6 months is eligible for this updated COVID-19 vaccine this fall. And there is strong recommendation that the vaccine getting the vaccine, the benefits far outweigh the risks. So they're recommending that everyone above 6 months of age gets the vaccine. These are the mRNA vaccines that have been approved. So Moderna and Pfizer. It is based on a descendant of Omicron, and it's called, I'm going to give the name, XBB.1.5. I know. No one needs to know that. The point is, it is
Sounds
an
like a droid
Omicron.
from Star Wars.
What?
Sounds like a droid from Star
It
Wars.
does. It sounds like a droid. I completely agree. It's just different arms and different lineages that they name all these variants for, which we went over. We had an episode on naming.
Yes,
It's crazy science, but anyways, it's all based on lineage and descendants. But this version, when the vaccines were being created, this was the most recent variant. Since then, some newer variants have come out that are descendants of this. And the vaccines are still holding up with very high protection based on the preliminary data that they have. So this should be very protective for us this fall. So anyone above 6 months is recommended to get it. So again, it's the mRNA vaccines right now that have approval. So that's Moderna and Pfizer. There is a Novavax protein-based version, the spike protein, which is just pieces of spike that are purified and put into the vaccine. That is not yet approved. There are some manufacturing things that still have to go on with Novavax, but that should also be available a little bit later this fall. They're hoping that will come and be available to anyone who would prefer that. But it seems like that vaccine will also have protection. A couple of things I wanted to tell you about this new vaccine is that it is showing to decrease hospitalization and also severe disease from preliminary data. So she was looking at hospitalization.
I missed you said it was decreasing hospitalization and what?
Severe disease.
Mm-hmm.
Yeah, severe disease. So, and this is true for kids. So there were different age groups. They were looking at from 6 months all the way to 17 years of age. And they found that over half the children that have been hospitalized for COVID did not have any other issues. So otherwise healthy kids. But those that had the vaccine were much more likely to have less severe illness. or decreased hospitalization. So the bottom line is, even if your kid is otherwise healthy and doesn't have any other underlying illness like diabetes or, you know, something else, that getting the vaccine is going to, you're on the fence about getting your kid the vaccine. If they haven't gotten it before, you should still highly consider getting the vaccine. This has also shown that we know long COVID remains a risk, and that when you get the vaccine, data is continuing to show that this will decrease the chance of long COVID if you get the vaccine. So that's
right.
you know, holding up. And from what I've heard, long COVID is not fun. There's a lot of
Yeah,
fatigue.
no, that is a big selling point, honestly. The plug for like not, if you're not afraid of COVID,
Yep.
you're still at risk for long COVID, and long COVID is terrible. And so that is one of the most exciting pieces of the vaccine, that it's still demonstrating that your chances, your risk of it is lower.
Yeah, so this is true for adults and children. The data is showing that long COVID, the chance of getting long COVID is greatly reduced for kids and adults, particularly if you have been staying up to date with vaccines. If you only got one vaccine back in the day and you haven't had another, your chance for long COVID will likely be slightly decreased, but not as much as if you stay up to date. So continue to get those COVID vaccines to make sure that your immune system is still ready to fight. The other thing I wanted to mention that was, I think, really important is that myocarditis was not seen as a safety signal at all for this last one. So you still see minor numbers of some males having the increased risk of myocarditis, but it's not enough to consider it to be like a real safety signal. So there's still a very, very, very small chance. In fact, I will tell you, it was 2 cases out of 650,000 doses. So 2 out of 650,000. So it wasn't 0, but man, it was close.
That's less. That's much less than before.
I mean, so
that's much less than before, yeah.
Yeah, so that should be helpful, I think. There was also some data looking at how well antibodies from this newest vaccine version of the vaccine, that XBB 1.5, how well that held up against some of the newer variants protection. And it shows, I can give you names if you want. There's the XBB 1.16. There's the EG 5.1 and the BA 0.2.86.
Oh God.
And I will tell you what, there are more variants probably coming down the pike, but this vaccine, the one that we have currently right now for this fall, has proven to be protective against those newer variants that have popped up since this vaccine was manufactured. So that's really good news. It's telling us that this will still be very protective. It's still a good choice. So I would, obviously, we're recommending to get it. A couple of things came up as far as timing. So if you are wondering, oh, and by the way, this is a monovalent. The last fall was a bivalent. It was it was a vaccine that was created against an older version of SARS-CoV-2 plus then a newer Omicron version. So we called it a bivalent because it had 2 different kind of targets in it. This one now is neither of those. It's this newer variant, this XBB 1.5. So it's like it's an upgraded version, and it's just that one because it seemed as if that would be the best target to go after, since all those older versions have kind of phased out as far as what are people getting sick with. Those versions had phased out. All these newer ones are coming on board. So it made sense to kind of keep updating and modernizing the vaccine. But as far as timing, they're recommending that if let's say you just got your last dose, which I didn't even really realize that they were still available, but apparently some people can. They would recommend that you wait at least two months to get this newer version. If you've had a previous infection recently within the last 3 months, they're suggesting that you wait at least 3 months because you do have some protection from that recent infection. There's a little bit of, I think there's a little bit of debate amongst the medical community. Some people are saying you might want to wait even up to 6 months because your protection from a recent infection could last through 6 months. So I think it's somewhere between the 3 to 6 month window, but I wouldn't recommend going more than 6 months. Because again, being infected will also provide protection. So wait at least 2 months if you've had the recent vaccine, wait at least 3 if you've had 3 months if you've had a previous infection. And then the other thing I mentioned was, I think I have it on the other piece of paper. If you have a child who has not been vaccinated, there was some conversation with the ACIP and the CDC with that as well. If your child has been previously vaccinated, they're recommending either 1 dose of the Moderna or the Pfizer for this new fall vaccine. But if you have a child that has not been vaccinated, like you've just kind of been on the fence this whole time, or maybe they're just turned 6 months, they're going to recommend for kids that are 6 months to 4 years that had not been vaccinated, that you follow along with like kind of that original dosing where it's like 2 of Moderna or 3 of Pfizer. And this is again because their immune system needs to be trained. Hadn't been trained and you want to give them the best protection possible. And then if your child is over 5 years, they were saying that just the 1 dose of Moderna or Pfizer should be fine for those kiddos. Maybe they're thinking that they had been exposed to it, or I don't know, but that was the guidance that was coming from the CDC and the Advisory Committee on Immunization Practices. So again, if you have any questions about this, you can re-listen. You can re-listen to the podcast if that's fun for you. Or I would look at your local epidemiologist, that newsletter. The other thing is you can always go on to the CDC website. They will often update all the recommendations. And then the Advisory Committee on Immunization Practices, or ACIP, which is kind of an arm of the CDC that talks about immunization, they'll have some updated info as well. Dr. Tony, is there anything that you think? Oh, other thing, you can get your flu shot at the same time.
Yes, that's right.
We've looked at the data on that, and it looks like it's totally fine. You're going to have a really good response to the flu. You're going to have a really good response to SARS-CoV-2 or the COVID vaccine. So they're not going to interfere with each other whatsoever. So if you just want to have one appointment, go in and get your COVID and your flu shot together. Oh, and then the last bit of advice that this epidemiologist, Caitlin Jedalina, she was saying, if all of this is just too overwhelming for you, just make sure you get the flu and the COVID vaccine before Halloween.
That's great.
That's her, like, if you want to simplify, just say, okay, before Halloween, I will get my flu shot and my updated COVID vaccine. That should make it as simple as possible. If like all the rest was just like when and what and how, just before Halloween.
That's right. That's great. I think I will like just to add that clarification. I was going to add that too in terms of timing. I think that you can take it, think about 2 weeks before you're going to do something spectacular. and then you can get your vaccine. I think that's what I'm actually going to use. And also I'm going to use that because I'm not an immunocompromised person. You know, I don't have multiple comorbidities. And so, and I have no problem masking. And so because I have no problem masking and I don't have an autoimmune disease, I don't have, you know, I'm not immunocompromised and in any way, shape, or form as of today, you know, I am comfortable waiting. This is risk tolerance. I'm comfortable waiting until I know I am, you know, eye to eye with like an indoor event that's going to prevent me from enjoying my Christmas is when I'm going to time my time for my shots and for my family as well. And so I think that if you have any questions about what Dr. Amy said, please hit us up. We'll try to explain it a little bit clearer. If there was something that was confusing, you know, we love getting those flags so that we can actually make those things better. I don't know if you can explain this, and I will cut it out. And I don't know if you want to unrecord so it doesn't mess with the YouTube yet. But what comes up for me, a question that I think somebody would have was that early on we said that we don't want you to depend on getting infected naturally because we don't know what the immune response is going to be. And when you have a vaccine, we can control your immune response versus if you get a natural infection. And so now we're actually saying, like everybody is agreeing that if you get infected, that it does confer some immunity to COVID. So are we able to reconcile that at all for folks?
So that's, I mean, yes and no. So what's been shown in the data from infection out in the wild, that's you get immunity from the grocery store or being on the airplane where you catch COVID. We always knew that your immune system would respond and you would definitely have a response. So I don't think that was ever, I don't think we were ever arguing that. I think the issue was when you get a vaccine, you know that you're getting just the spike protein. You're getting a like a certain dose, right? So that's a controlled dose. So you're going to have a pretty robust immune response from that controlled dose based on the fact that they do dosage studies and clinical trials. So that's a piece of it. Another piece of it is that when they were looking at clinical data from antibodies from people who got COVID out in the wild versus COVID in vaccine form, they were showing that the antibodies from the vaccine tended to last longer and were a little bit stronger. Again, it may be because of that controlled dose. Maybe it was like a higher dose. So that was another piece. And then the third piece, and I, answer this in this way all the time. Not everybody makes it through COVID, so yes, you can absolutely get immunity from getting it in the wild, but you may not everybody makes it out of COVID. It's like Russian roulette. We don't know. Some people who are otherwise healthy die, right? We don't know. So the vaccine trains your immune system. It's just the spike protein. The spike protein can't kill you. We know that for sure. It's all of the other bits inside the virus that will take over your cell, that will make more virus, that will cause more virus to be released and then take over your lungs. That's the part. So like when people are pretty adamant with me, like, well, I'm just going to get it out, in the wild. And I'm like, okay, it's totally up to you. However, there's no guarantee you're going to make it out.
Right. Or not get COVID, which is the other.
Right. And the long COVID is another bit. So you absolutely can have immunity. I think though, that for us to say that it's the same as the vaccine, you would likely need to look at each individual's immune response and antibody levels, which, that would be costly and whatever. So there's absolutely an immune response. Is it as long lasting? Is it as robust? Clinical trial.
That was the issue.
Yeah. That's
I
what,
think it was that issue, was that how long lasting it is. And then I
Yep.
think also when they're saying that, and I wanted us to qualify it a little bit more and to
Mhm.
make it clearer, is
Mhm.
that when I've heard about it, it's kind of like, also we're talking about folks who are probably immunized already with the vaccine, who like maybe didn't get another dose before they got infected. And so if you've had other doses and you got infected, then
Yeah.
your immune system's going to be better. That's the point of getting vaccinated, right? Your immune system is going to be better than if you hadn't gotten vaccinated in the first place.
Yeah.
And so what I wanted to make sure, I just was playing in my head, people are hearing that like, oh, but if you've got natural infection, you definitely have immunity. So you could wait 6 months till your next one. They're going to be like, huh, they lied to us. They told us that, we shouldn't get we should get vaccinated because getting it naturally wasn't going to confer immunity.
Well, 3 to 6 months, 3 to 6.
And I wanted to, and I wanted to be clear that like, it's not that we didn't think it did. We just didn't know how good of a protection it would be, number one. And then number two, there's always this long COVID sequela that we don't want you to have. And that like, if you got vaccinated, if you got 2 shots, if you got 3 shots, and you get a natural infection, that immune response is going to be better than if you never got any shots and you got a natural infection. Like those are not, those are apples and oranges. It's not the same. So I thank you for clarifying that, Amy. I wanted to make sure that we did that.
Yeah, no, I think that was good because there are definitely, questions, I think, like that come up very, very frequently.
Yeah, no, I think that was,
Yeah.
explanation.
Yeah, our immune system is always responding. It's whether or not like how strong or how good it is.
That's
right.
That's right. And if it's too strong, that can actually work against you.
Right. Like in the beginning in the very beginning, when some of these COVID patients were going to the ICU, and their lungs were just filled with immune cells that the immune system was just trying so hard to get rid of it. But it's kind of like when you crowd your lungs with so many immune cells, you're not leaving room for air. Right. So, and the reason why they didn't give steroids in the beginning to dampen the immune response or suppress the immune response is because with other respiratory illnesses, that's contraindicated, meaning that they don't like to do that because it hasn't been shown to be helpful. However, with SARS-CoV-2, I think and COVID-19, I think after a bit of time with these patients not doing better and have to be put on like, ventilation and all that, they started trying steroids, and that was actually proving to be helpful. But if you were to look at other respiratory illnesses that kind of came on similarly, where people would be in the ICU, that wasn't. So it was just kind of, it was just, things change. We have to follow the data and science has to do the best that it can. But man, there's so much that we've learned since then.
Yeah. Have you gotten any updates about chloroquine? Because that actually came up the other day in one of my family conversations, that it's still a miracle drug for COVID that we're hiding.
Yeah, no, I have heard that it's really not helpful with, everything I think points to the fact that it doesn't really do much. And then ivermectin also not.
That for sure.
That thing.
For sure. But chloroquine is still coming up as something that should be able to treat.
Yeah.
And I just, from what
I've not seen it.
What I've seen, I have not seen that it actually made a difference.
I've not seen it being beneficial. Yeah.
Yeah. And so, yeah, I will look again to see if there's anything new that has come up with that, but I have not. I just wanted to say that because that did come up in a conversation.
Yeah. The thing is, if we had something that worked amazingly, like vaccines, we give them to everyone.
We would give it. Like, we're not trying to.
Yeah.
I don't know. There's this, it's still floating around that like we're hiding treatment and stuff. And I think that like everybody's been affected by COVID. Like this has touched rich and poor together. And more poor than rich, honestly, but rich has been affected by this. And so I don't think that as I'm talking today, everything, things change in the world. And I don't like to in absolutes, but like as I speak to you all today,
Mhm.
I have not seen if chloroquine was a cure, we would give it.
Yeah.
We would give it en masse, and I don't think
Yeah.
that we would
Yeah.
um try to hide that. I think somebody would blow that open in some type of study.
Yeah, for sure. No, it's just not. What really made me sad about that, though, is there are actually people with autoimmune disorders that need that.
Right.
And it was running out. And people who need it and have needed it for years for their autoimmune diseases were having trouble finding it or not able to get it because people were trying to get that for COVID. And it depleted the supply for the people who rely on that to live for other diseases where we know it is an effective treatment.
Right.
So that, yeah, that just is unfortunate. But yeah, I haven't read anything about that being
Anything recent,
helpful.
right? Yeah.
Yeah.
It definitely came out in the beginning, and I think it was looked at, and it just depleted resources for treating what people actually could use it for. I'm not saying
Mhm.
that it's not, it may, because it does treat some autoimmune diseases. Like, I'm not saying that, maybe that's the same mechanism and that it could be helpful, but I don't think it's helpful in every instance, like Paxlovid, right? Like,
Right.
it's not
Yeah,
the
because
same.
that just goes after the virus.
Right. And then Paxlovid, and the point that I had been making in the conversation was like Paxlovid at the moment is free. Like, you don't have to pay for it right now. That might change, and there's billing and commercialization that's going to happen in the next couple of months.
Mhm.
But I think that it's important to say that, like, as it is now, you should be asking for the one drug. You're not paying for it. You're not paying for it. So there's no
Yeah.
money-making scheme at the moment when it comes to treatments that are available for treating COVID. So I just want to make sure that that's clear.
Yeah.
One of the myths we wanted to debunk while we were here.
Yeah, absolutely. And then I'm going to end on kind of an interesting note. So, right when this pandemic was about to start, I made my family watch the movie Contagion.
Oh my
Have
God.
you
I
ever
watched
seen that?
during the pandemic, during
Yeah,
the
so I had seen it before. And when this was starting to pop, like early March, I was like, we need to watch this. And it was very interesting. My two kids and my husband, who was also a physician, were like, well, this would never happen. And I'm
yeah.
like, really? So we actually recently rewatched it. And it was funny because the three skeptics were like, whoa. I mean, not all of it happened, but a lot of it did. And I was just like, okay, people, this is coming down the pike.
Hilarious.
Well, the guy who made the movie is, I think, an epidemiologist or infectious disease. I mean, there's definitely like some serious knowledge.
Yeah, seriously. We actually watched it, like, at the height of the pandemic, which was probably not the thing to do. And I was like, oh my God, this thing was predicted, but it was also predicted there's a book that got me into this. You remember when the Hot Zone came out?
Oh, yes, yes.
There was a book that it was based on called Virus Hunters of the CDC.
Mm-hmm.
That book tells you this. I mean, I was like, oh my God, this tells you the story. I've read this thing 20 years ago. But
Mm-hmm.
that book also,
Yeah.
that was one of the books that got me hyped about medicine, and also an epidemiology was like that book. That was a pretty cool book.
Yeah. Yeah. It's cooler when it's not happening at the moment.
Right. True. But,
Yeah.
epidemiologists, and I think even now, like, everybody's finally like openly saying,
Mm-hmm.
we're not immune from this happening again. Like, we just have to be on especially with climate change and all of that stuff, like,
Yeah.
Vibrio in the coastal waters now, like, we are in a place where it's like man against planet.
Mm-hmm. Yeah, I was having a conversation with one of my friends the other day, and she was like, planet Earth is trying to shake us off.
Yeah, really.
And
We're like the fleas and ticks.
I mean, water, fire,
All of it.
drought, virus, whatever. Anything it takes, Mother Earth is like, get the hell off.
Get the hell off. Right. Because we're just we're mistreating her. We're mistreating her, which is another podcast.
I know,
But
that's another topic.
whole other topic. You know us, we can go off, but this was awesome.
Yes.
Thank you so much. I'm so glad that we got a chance to connect on this. And you
Yes.
guys know what to do. You need to go ahead and email us at Dr. Tony and Dr. Amy at gmail.com. Let us know your questions, your topics that you want us to hit, and we will try to deliver. See you
Yeah.
next time.
Exactly. Until episode 2. Talk to you later.
Bye.